Which of the following strategies best reduces the incidence of acute lung injury during CPB? A. High tidal volume ventilation. B. Prolonged cross-clamp time. C. Leukocyte-depleting filters. D. High-dose inotropes. Answer: C. Leukocyte-depleting filters. Explanation: Leukocyte-depleting filters in the CPB circuit can reduce inflammatory mediator release and microembolization, thus helping to protect the lungs from acute injury and improve postoperative respiratory function. Which postoperative complication is most closely associated with neurocognitive decline after CPB? A. Elevated creatinine. B. Atrial fibrillation. C. Microemboli and hypoperfusion. D. Hypernatremia. Answer: C. Microemboli and hypoperfusion. Explanation: Neurocognitive dysfunction, including delirium and cognitive decline, is commonly due to microembolic events and cerebral hypoperfusion during CPB. Air, fat, or atherosclerotic debris may embolize, especially in older patients. What is the primary cause of liver congestion during and after CPB? A. Right heart failure. B. Left heart hypertrophy. C. Atrial fibrillation. D. Low-dose dopamine infusion. Answer: A. Right heart failure. Explanation: Right heart failure leads to elevated central venous pressure, causing hepatic venous congestion. This can impair liver function and elevate liver enzymes postoperatively. Which of the following strategies helps minimize renal injury during CPB? A. Use of mannitol to increase urine output. B. Reducing perfusion pressure to limit filtration. C. Avoiding diuretics. D. Increasing oxygen delivery and maintaining MAP greater than 70 mm of mercury. Answer: D. Increasing oxygen delivery and maintaining MAP greater than 70 mm of mercury. Explanation: Maintaining adequate perfusion pressure and oxygen delivery is essential to prevent acute kidney injury, AKI, during CPB. MAP greater than 70 mm of mercury helps preserve renal perfusion, especially in high-risk patients. What is the mechanism behind gastrointestinal mucosal ischemia during CPB? A. Sepsis-induced vasodilation. B. Portal vein thrombosis. C. Splanchnic vasoconstriction and hypoperfusion. D. Duodenal ulceration. Answer: C. Splanchnic vasoconstriction and hypoperfusion. Explanation: During CPB, non-pulsatile flow and hypotension result in splanchnic vasoconstriction, leading to reduced blood flow to the GI mucosa. This can cause mucosal ischemia, ulceration, and even bowel necrosis in severe cases. What is the most significant risk factor for stroke during cardiopulmonary bypass? A. Prolonged cross-clamp time. B. Use of cardioplegia. C. Embolization of particulate matter. D. Hypotension during weaning from CPB. Answer: C. Embolization of particulate matter. Explanation: Embolization of particulate matter such as air bubbles, thrombus, or atheromatous debris during CPB is the leading cause of stroke. These emboli can obstruct cerebral vasculature, leading to ischemia and neurological deficits. Which of the following is the most common cause of hemodynamic instability after CPB? A. Vasoplegia. B. Hemorrhagic shock. C. Septic shock. D. Cardiogenic shock. Answer: A. Vasoplegia. Explanation: Vasoplegia, or the loss of vascular tone, is a frequent cause of hemodynamic instability following CPB. This condition often results from the systemic inflammatory response and can be managed with vasopressors like norepinephrine. What is a significant mechanism by which CPB causes myocardial injury? A. Increased coronary perfusion pressure. B. Hypoxia from inadequate oxygenation. C. Mechanical trauma due to the aortic crossclamp. D. Atheroembolism during the procedure. Answer: C. Mechanical trauma due to the aortic crossclamp. Explanation: The aortic crossclamp used during CPB can cause myocardial ischemia and injury by blocking coronary blood flow. This may lead to reperfusion injury upon unclamping, which damages myocardial tissue. Which of the following measures is least effective in reducing neurological injury during CPB? A. Monitoring cerebral oxygen saturation, SCTO2. B. Using brain protective strategies like deep hypothermia. C. Minimizing hemodilution. D. Performing retrograde cerebral perfusion. Answer: C. Minimizing hemodilution. Explanation: while minimizing hemodilution helps maintain oxygen carrying capacity, it is less directly related to neurological protection compared to the other options, such as monitoring cerebral oxygenation or using retrograde cerebral perfusion for brain protection. Which type of fluid therapy during CPB is most associated with postoperative lung injury? A. Albumin infusion. B. Crystalloid infusion. C. Colloid infusion. D. Packed red blood cell transfusion. Answer: B. Crystalloid infusion. Explanation: crystalloid infusions during CPB can lead to pulmonary edema by causing fluid overload and increased capillary permeability, which contributes to post-perfusion lung injury. Colloid infusion is less likely to cause such effects.